Survivor's Day Video 8. Hello and thanks for tuning in today. Let me start with a little background about my cancer story. My name is Greg and I'm a 5-year survivor of a rare head and neck cancer. By the time my tumor was detected and diagnosed in a salivary gland, it had already made its way inside the bones of my jaw joint, just underneath the ear. From there, it invaded and destroyed the ear canal. It also wrapped itself 3/4 of the way around the artery that supplies blood to that whole side of the brain, and it was closing in on my voice box. I needed major surgery desperately. My surgery was performed in Pennsylvania by a team of 9 surgeons. It took them 20 hours. I spent about 2 weeks in the hospital, recovered at home for 2 months, and then started 7 weeks of chemotherapy and radiation treatments. The medical and nursing care that I received was phenomenal, and the support from family and friends was also amazing. All of the things I had been warned about before treatment started showing up, though, from hearing loss and dry eye to difficulty swallowing, loss of taste, painful skin burns from radiation, and pure exhaustion. I remember telling my wife at one point that it was so wonderful to be alive, but that the combination of all these things was making me feel really puny. Still, though hardly a stoic, I did think that I was holding up pretty well, at least for the first couple of weeks of treatment. As the days and weeks wore on, though, I knew perfectly well that I was getting worn down and out of sorts. I knew that the anti-nausea drugs every week helped a lot to tolerate my chemotherapy, but also that they added to my weakness and fatigue. I certainly knew that the radiation every day was brutal. I knew that the effects of radiation were delayed and cumulative, and that the fatigue and the facial burns would continue getting worse even after the treatments would end. What I did not know was that I was depressed. About midway through treatment, my wife told me so. And even though I resisted and denied it, she, as a licensed family therapist, was absolutely right. During our next weekly session with the radiation oncology team in the clinic, she asked the medical and nursing staff what someone had to do to get some mental health support around there. Well, that started a cascade of conversation, of course. And the next thing I knew, I was signed up for a 90-minute appointment with a psychiatrist. 90 minutes. To my surprise, that appointment turned out to be one of the most important treatment sessions of all. The doctor I met with specialized in mental health care for cancer patients. And she got me talking about the most terrifying experiences I had been through. I told her about the surgery, the hospitalization, the ICU, the ventilator. I talked about losing my father to a rare metastatic cancer when he was just 48 years old. I was 16. I talked about my fears, my hopes, my sleepless nights. I talked about my family, my friends. The doctor explained just how normal and reasonable my emotional reactions were in light of what I was going through. She did not prescribe any new medications. She did recommend some behavioral remedies, though, like taking walks, doing relaxation exercises, and even taking yoga classes right in the treatment center. She also recommended support groups and a survivorship program once I got back to Connecticut. She was right about all of this, but especially about support groups and the survivorship program. Through these programs, I have found all kinds of help and support through yoga, Tai Chi, acupuncture, physical therapy and nutrition counseling, and even a writing workshop, all through the integrative medicine programs at Smilo. I know that I derive strength, meaning, hope, and confidence from the other survivors and the professional staff of all these resources. I also know I may have helped to support many others. I urge my fellow cancer survivors to explore these options for themselves, to find out how therapeutic they can be. Let me close by reading a short poem that reflects a lot of my experience as a survivor. It took me over a year to finish writing it, and it was published in Cure magazine in 2016. If you're interested anytime, you can find it online with other poems and cancer stories of mine at www.curetoday.com. That's curetoday.com. I've sent the full URL link to the survivorship office, at Smilo, so maybe it can be attached to this video somehow or made available on request. So here goes. How Fireflies, an encounter with head and neck cancer. Scorching embers soar aloft, miniature torches in thick clouds of smoke, driven by a fierce summer wind that toys with the wildfire below. Like fireflies, the sparks float away, igniting more of the dry wooded canopy as they land. Cancer cells cast off sparks that float away, inside the canopy of human physiology. Riding along lymph, nerve, and blood lines, these fireflies create malignant hotspots, too small to be seen as images, too well disguised for the body to attack. Once found, they require powerful regimens, some massive and blunt, others small and precise. The forest floor shows the first signs of rebirth. Sprouts emerge. Fragments of brush, grasses, and seedlings take shape. Over time, the forest recovers. From charred roots, rotted limbs, and nourishing ash, new growth feeds on the debris of the old. Cancer care also moves on, advancing its science, mourning its losses, and raging against the firestorms, while its recurring cycles endure: sickness and health, relapse and recovery, death and rebirth. Personal narratives endure as well, in a community of patients, families, trusted friends, and healers. In our support groups, stories evoke nods, grimaces, and soothing laughter. Eyes once drained by surgery and radiation are misty. Hopes rise, fall, and rise again. How fireflies, how we yearn and fight for fresh new sprouts, the seedlings of life. So thank you for listening, and take good care.